I want to speak for a minute about reform for small business in America, and there were many different reasons expressed by members of Congress about why we began engaging in this very tough debate on health care. Many different issues brought us to the table. One of the issues that brought me to this table of reform and negotiation was the desperate plight of small businesses in America, Mr. President, who have nowhere to turn. As my colleagues have said in their very excellent statements this morning, the unpredictable and unsustainable and skyrocketing cost of health care to small business in America is damaging their ability to grow, is participating in an uptick of bankruptcies, is diminishing their ability to hire people and to create jobs at a time when our country needs those jobs created, perhaps more than ever in the last 25 or 30 years. So until we get health care right for small business, they can't get job creation right for America. And it's as simple as that. So as difficult as this debate has been, and it has been, very long, very arduous, with lots of different views, one thing we must get right in these final weeks and months of this debate is getting it right for small business. I've heard from hundreds of small business owners as chairman of the Small Business Committee. My members have heard from hundreds. We've heard almost from thousands through their representative associations, from conservative associations to moderate to more liberal associations, representing a broad stretch of small businesses in this country, saying this is their number one issue. Just this week, Barbara Beersmith, who owns Sylvan Learning Center in Monroe, a small business owner, one of 27 million that actually exist in the United States of America. 27 million, that's a lot of people, it's a lot of businesses, it's a lot of employees. She's one of them. This is what she wrote in the Monroe News Star this week. As a business owner, I have struggled in vain for more than 22 years to find a way to provide health insurance for my employees. Health insurance providers tell me I have too few employees to make a group. Or they tell me that one of my employees has a pre-existing condition that exclude them from a group, and that would then make the group too small. The kind of highly educated, experienced people I prefer to hire nearly always have pre-existing conditions. Who doesn't have a pre-existing condition, she says, by the age of 30? Considering that being of childbearing age with some of these plans is now a pre-existing condition, just being of childbearing age and being a woman is now considered a pre-existing condition. I think Barbara's right. Who doesn't have a pre-existing condition these days based on the interpretation of some of these policies? She goes on to say, because my business can't provide good health benefits, I'm restricted to hiring people who are covered by their spouse's medical insurance. And this is something that's not talked about often, so I'll take a minute, and I know my colleague from Washington is waiting to speak, so I'll go through this as quickly as I can. I hear this over and over again when I'm home on the streets and in the towns and communities. I don't hear it here, so let me say it. I have any number of people that come up to me and say, you know, Senator, thank you for working hard on health care. I'm a little concerned or confused about what you all are doing, but try to get it right, because my health care is through my spouse who works for the government, or my health care is through my spouse that works for a big company. If I didn't have that health care, I was just in a restaurant last week, the gentleman that owns it was telling me this, I couldn't be a small business owner because at least my health care is covered through my spouse. It's time for us to get the policy right in America to everyone can go to work and say they have health care that they can afford and access to it. She goes on to say, I hope and pray our representatives and senators soon pass federal legislation to help really small businesses of America. Let me say that I hope that help is on the way. If we can negotiate this bill in terms of robust exchanges, subsidies for small businesses, particularly these very small businesses of under 10 employees or 25 employees, it would really help. The situation Barbara's facing is not acceptable and must be corrected, but her situation, as I said, is not unique. According to a report by the Small Business Majority, healthcare costs for small businesses are expected to increase from $156 billion in 2009 to $2.4 trillion by 2018. Now, before I put up the next chart, I just need to repeat these numbers because they are dramatic. These are numbers published by the Small Business Majority Report based on actual data. This is a bill, Mr. President, small business cannot pay. This is a bill, Mr. President, they cannot pay. We must get this cost moving in a different direction. It will take some time, but we must get this chart from going up to down. And that is why I have pushed every day of this debate to focus on cost containment. Not only is it important for taxpayers and for the government, it's absolutely critical for small businesses to have more choices at lower cost. This shows the graph in a different way. This shows the cumulative cost of health care benefits, and the first one, and now this is the job loss, which will move from 178,000 small businesses will be lost in 2018, up from 39,000 because companies just can't continue to hire if they've got to pay higher premiums for the employees that they still have working for them. Costs are high because a broken insurance market with insurers, in order to satisfy their stockholders, put a greater focus on their bottom lines. And I understand when you're in business, you need to make a profit. And I understand that's why you're in business. I, as a Democrat, have no problem with people making profits, and significant ones, as long as the rules are fair and as long as there is opportunity to keep our values in order. And one of the values that we have here in America is people going into business, making a profit, but making sure if you're in the business of insurance delivering benefits, that's what you're delivering to the people that you are trying to serve. And so we need some adjustments in those rules and regulations, and that is what I think we are doing in our reform bills. But more alarmingly, getting back to the statistics, according to some reports, including recent New York Times article, the insurance companies are planning to raise rates even higher today in anticipation of our reform efforts. This is very unsettling, and the sooner we act, the better I think that we will be to help reform this market, to bring some order and and a framework that would be extremely helpful. Lack of choice and competition is a problem. As I said, in Louisiana, our two top insurers maintain 74% of the market. In Alaska, I understand, their two insurers maintain 95% of the market. This is not real choice. It's not real competition. And that's why the exchanges that we have in most of the base bills, making them more robust, making the subsidies as generous as we can to encourage individuals to assume responsibility for their health care, as well as subsidizing small businesses to encourage them to get into these larger pools. I really believe, and many of us believe, that that will help to drive down cost as we reform the private market. To level the playing field for small business and to provide working families with more choices at lower cost, the bill we will vote on here in the Senate will have as robust an exchange system as possible. These exchanges will allow businesses and individuals to pool to give them the negotiating power and to spread risk. We estimate, Mr. President, today that small businesses, as Senator Warner said, the senator from Virginia, pay retail. Everybody else pays wholesale. Small business pays retail. And the price of paying retail is a minimum of 18% more on your premiums that you're paying than large businesses. So we want to get that savings. The exchanges will achieve that. The exchanges will also achieve a lower administrative cost, so you don't have to hire a full-time lawyer or a full-time accountant to navigate the wide variety or actually limited choices today, that you will have more transparency, more robust exchanges. And finally, regardless of the level of benefit choices, there should be a limit on how much individuals spend out of pocket and minimum standard of care among all plans. These are some of the protections that we're working on for small businesses and will benefit individuals as well. So again, I thank my colleagues for being on the floor this morning. I think Senator Cantwell, the senator from Washington, is here to give voice to this important part of the debate. And again, we have hundreds of members of Congress. We all came to this debate carrying various issues and with greater concerns than others. One of my great concerns has been, as we try to find a way to dig ourselves out of this great recession, some say the worst economic situation since the Great Depression. Mr. President, the only way we're going to do that is for businesses to create jobs. And right now, there is a big burden that they've been carrying alone. They need help, they need support, they need more tax credits, more robust subsidies, a more orderly private market framework that allows the insurance companies to be in business and to make a profit, but also allows small business to be able to afford quality coverage for American workers so that we can get back to being the most productive workforce in the world.